Hi, this is Ron, still in my clinic in Oliveira do Hospital, and you can imagine that I'm still wearing the same shirt as my last video, so I'm probably doing it together, but that's okay, I'm allowed to do that. I want to talk today about shoulder pain, and just like lower back pain, I'll differentiate between chronic and acute pain. Let's start with acute first. So, something happened and your shoulder is hurting. May have fallen from a horse, bike, run, or did a movement that caused you a big pain, and now the shoulder is painful. If the shoulder is very, very, very swollen, then go to the doctor, because you may have torn something and you may need a different type of treatment than the one I will offer here. But if this is not the case, and if the case is not when you have very swollen shoulder, then I can help. And in most cases, despite the fact that you'll get different opinions from different professionals, nothing is torn and nothing is problematic, and it can be usually fixed. Now, fixing shoulder is a bit more difficult than fixing lower back pain, because we need to find out what is a root cause for that pain. And it really depends on the story that when you come here and you tell me, I need to know, according to the story, I can find out what the root cause is. If it's a trauma, then I'll treat it as a trauma. And the 99% of the times, just like in lower back pain, the big pain, and it makes no difference where the pain, you feel the pain, and most of the time it's going to be around the shoulder blade. It does not mean that the problem is there. In most cases, I'll find the problem in the arm. Somewhere where the muscles are connected to the arms, I'm going to find a very, very traumatic and very, very hurt muscle. And the treatment is going to be to open up that muscle very gently. It doesn't hurt the way I do my treatment here. I use different techniques. Sometimes I use heat, similar to the treatment I use with lower back pain. But in most cases, I'm going to do a very, very gentle massage in places where I find muscles and fascia actually being tight. And I release the shoulder like that. Some other times I will find that the problem in the shoulder, we're talking about acute pain, can be derived from around the neck. And again, depending on the story. In this case, I use needles and I use heat in order to open. But again, I don't need many sessions to fix that. Usually it can be fixed within 1, 2, 3 sessions at most. It doesn't take longer than that. Very similar to most of the pain that you're going to experience. Now, when it comes to chronic shoulder pain, and it doesn't make a difference if you have what is called a frozen shoulder, which means that you have a limited range of motion, or if you have a full range of motion but there's a big pain, I will need to look for the root cause for the pain. Sometimes I will find the pain in the shoulder itself, but it's going to be usually somewhere in the back. But a frozen shoulder or shoulder pain can many times be derived from pain that is lower back pain. And I will find the pain in there. So I'm going to look at the whole back until I find the areas which may be a bit more sore or a bit more tight. And by releasing them, the shoulder is going to release. There's only one caveat that I want to give here. Many years ago, I had a patient who came here and she had frozen shoulder. And when I searched for the problem, I found out that her lymph underneath the shoulder was full of fluids. And in this case, this is not a good sign, because in this case, this is not an orthopedic problem, but if the lymph node is full of fluids, that means that there is something bigger happening in the body. I sent her to the doctors quickly. Unfortunately, they found cancer, lung cancer. But this can only also be a reason for a shoulder pain. But one of the things that we can do here in the clinic is to diagnose the real cause for that pain and know how to treat it properly. If I said that an acute pain takes usually 1, 2, or 3 sessions, a chronic pain takes a bit longer, but again, it's not 10, 20 sessions. Usually it's between 3 to 5 sessions and most of the pain is gone. And here, it's very similar to other types of pain that I treat. I always like to give homework. If you do your homework, it goes faster. If you don't do your homework, come more. I'll be happy to treat you more. See you next time. Bye-bye.